Hey everyone, welcome back to another video on my channel. It has been way too long since I've sat down and made a video, so I thought I would do it today. And mostly videos that I've been making recently, I've just not been very happy about at all. So I wanted to make a video on something that I recently got diagnosed with. Not that this channel is about me just getting diagnosed with stuff, but I've had something wrong with me since I was a teenager, and I've been very aware that I've had so many different symptoms and so much wrong with me that I never got any real answers. And eventually I realised that a lot of the symptoms that I was having were connected in some way. And so 2 weeks ago I saw a cardiologist and I got a diagnosis of POTS. So I'm struggling to breathe right now, and that's a symptom that I have, is breathlessness. And I'm not quite sure why particularly now it's playing up just as I want to make a video. It just makes me sound like I'm like incredibly unfit, and I am unfit at the moment, but I have always had this symptom even when I was really fit and exercising a lot, which was a massive struggle, and I just thought everybody found it really difficult to exercise and was exhausted for hours after. Apparently that is not normal. So I guess it started when I was a teenager. I would have chronic headaches, I was struggling to breathe, I went from being able to walk around for hours and hours per day to doing different exercising. Like I used to go to dance school, and like I did so much kind of stuff like that, to not really being able to do much physical stuff at all. And like I would be walking home after having a day out, like I'd been on the train somewhere or a bus somewhere, and I'd be walking home right at the end of the day, and I just felt like I couldn't walk anymore. And I would get these weird spells where I wasn't really there, and I thought, you know, at one point I thought this must be like depersonalization, but I was just like really lightheaded and brain foggy, and my vision was going blurry, and it really freaked me out. So I started getting really anxious about these symptoms, and that's why some of my anxiety came into play, like was because I was getting health symptoms, and I started to feel like I was a hypochondriac, because I knew I was having physical symptoms, and I was going to the doctors about having physical symptoms, but I was being treated as if I had mental health problems, or I was like the things that I was experiencing I wasn't really experiencing though. So it's kind of how I felt like I was being treated for a long time, and I guess on some level, like maybe it was my fault because I was going with like, I'd have like breathlessness, and I'd go about that and say I think maybe I've got asthma or something, and then I did a breathalyzer test, and I had blood tests and stuff, and it turns out that I was iron deficient, so that must have been the cause. So next time that happened again, I thought I must be iron deficient, but it turns out that I wasn't, and so it just didn't really make any sense what was going on with me. And since I was a teenager, I had got chronic headaches, and I'd always go to the doctors like, I'm having headaches like every day, what is this? And seriously, like one doctor just gave me a load of cocodamol. I was like 17 and she just gave me a load of cocodamol and said to take these like when I was experiencing headaches, and I did not like the sensation that I got from taking cocodamol. Now I feel very different about it because they help my migraines a lot. So that's another thing, like I developed migraines as well. I'd have periods of time where I was really bad and periods of time where I wasn't as bad and I could cope. And I definitely pushed myself through, you know, all these flare-ups that I was having, and I don't know, just over time, like I was just experiencing all kinds of different symptoms that I couldn't really piece together. I had major acid reflux problems, I had bladder problems, like I was in so much pain with that. I had all kinds of different health complaints I just couldn't put down to any one thing. And I remember at one point I went to my doctors, I think I saw a nurse, and I said, you know, I'm really struggling, I think I might be anemic because I've been so before and I feel that way again. And I had to come home because I just, you know, I'm just so exhausted all the time, and you know, my heart rate's really fast and I just don't understand what's going on, and I'm feeling all lightheaded and dizzy all the time, and she was just like, okay, we can do like blood tests for you, but I just want you to lie down. So she got me to lie down, and she did some breathing with me, and she looked at my heart rate and said, okay, your heart rate's gone right down. It must be stress and anxiety. So that's when I started going to CBT and somehow convinced myself that, yeah, this was like anxiety, right? And the therapist would be like, so what thoughts are you having and where did they come from? And honestly, I wasn't having thoughts. My thoughts were, like, I was having a lot of thoughts, but they weren't like anxious thoughts. They were like, I feel like I'm gonna pass out. That was my thought. Why are you afraid of passing out? I'm like, well, because passing out isn't very nice. Like, and they were really trying to dig where these thoughts were coming from, and basically, without getting into a long story, like, it didn't work. And it was because I had something physically wrong with me, and I was trying to push myself, and I was trying to go on these days out, and I was trying to work full time. I was trying to stand up for hours on end, and it wasn't working. And of course, when I went to see the nurse and she got me to lay down, my symptoms would go down, because POTS is a disorder, which I'm going to get into now. It's a condition, basically, that is more affected when you are in an upright position. As some people say, just me and gravity just do not get along. So it's a fairly newly recognised condition. So if I'd had this like 40 years ago, no one would probably have had a clue what was wrong with me, and I would have just gone throughout my life with all these symptoms, which aren't technically life-threatening. I guess if you pass out, there's a chance that they could be life-threatening then. And some people pass out when they're sitting as well, not just standing. Thankfully, I have never passed out, but I have been very close to passing out multiple times. And I would go as far to say that this condition affects me all the time when I'm in an upright position in some way. And yeah, that's quite a revelation to me now. So, postural tachycardia syndrome, POTS, is an abnormality of functioning of the autonomic or involuntary nervous system. It is defined as an increase in heart rate of over 30 beats per minute when standing upright. Typically, there is no postural fall in blood pressure, although fainting can occur. The symptoms can vary, but mostly involve orthostatic intolerance, so symptoms that develop on standing up and are relieved by lying down, and are often made worse by various daily activities like physical exertion or eating. And it's a disorder which is slowly being recognised by the medical profession. So this part here is really, so what I'm reading from is STARS, which is what my cardiologist recommended me to look up. It says, POTS is often underappreciated by physicians, which can impact on the patient's quality of life through misdiagnosis or being informed symptoms are all in their head. Historically, many patients with POTS were given a diagnosis of chronic fatigue syndrome, anxiety, or panic disorder. And years ago, I got a diagnosis of panic disorder, and yeah, that's what I used to think. Like, I'd be out somewhere and, you know, I'd be okay for a little bit, and then after a while I would start to feel really lightheaded and I'd feel like I'm going to pass out, and then I'd get afraid that I'm going to pass out, so I would leave the area. And they were saying that what was happening, I was having panic attacks when I wasn't. So I would get really shaky, like, it's the type that I definitely think I have. They don't type it anymore, but the type that I think I more relate to is the type that's affected by adrenaline. So you're really sensitive to any kind of adrenaline is going to set it off, basically. So like rides, I can't do anymore. Like when I was a kid, probably, but as a teenager, I cannot do rides or anything that's going to give me adrenaline, because I get all these horrible symptoms from it. So that's just part of it as well. So, however, one key factor in POTS is that symptoms generally occur when standing upright rather than in a situation that causes distress or worry, as in panic disorder. That's why I knew that it wasn't anxiety and panic, but somehow medical professionals convinced me that it was. So I would literally stand up at work for 12-hour shifts, and I would get 3 breaks during the day, and so, for some times like I would just feel so terrible and lightheaded and dizzy, and I would continue working, and I would like go down and pick stuff up off the floor, which really messes with me. And like I would do all this and I'd be shaking all day, and I'd be moving my legs around to try and get, now I know it's because I was trying to get like the blood flow going, because it's also has something to do with your blood not flowing around your body properly. It stays like more towards the lower half of your body, and you need to like drink more and increase salt and all of this other stuff to increase the blood flow in your body. So I'm probably not explaining this like very well, but I'm trying to make this really quick. So I was standing up for 12-hour shifts, and I was going to this therapy, and they were saying to me, you know, you need to get over this fear by staying when you feel like you're going to pass out, like when you're getting all these symptoms and you're getting a panic attack coming on, stay in that position, stay there, and then you'll realize that you're not going to pass out. And so they were trying to do exposure therapy, I guess, for me, when that was never going to work for me. So I don't know if I caused more harm than good, but I definitely felt very exhausted and worse for doing that. And then sometimes I'd be so bad that I'd feel like I'm having a panic attack or whatever I thought it was, and I'd go to the toilets and I would sit down, and then I would go back and I'd maybe feel a tiny bit better, or I'd go for a drink, and I realised over time that certain things would make me feel better. So drinking a lot made me feel better, even though I had to go to the toilet more. Maybe that wasn't a bad thing because I got to sit down, which was, you know, halfway between standing and lying down. And so I would do all these things that I realised that helped me overall. And now I realise that these things actually help the condition anyway. So I was just kind of figuring them out on my own. And then when I started working in a job where I could sit down for much more of the time, I started to feel a lot better. But then over time, what happened is my fitness levels decreased massively, which also makes POT symptoms worse. So now I'm in this position where, like, I've been to a cardiologist. So I went to my GP a year ago, and I said, like, I think I've got all these symptoms. Like, look at my all my like Fitbit graphs, you know, my heart rate graphs, and they were just up and down. And you could tell, like, in my old job, where I was sitting down on lunch, there'd be a massive drop. So I went about a year ago to my GP, and he was just like, okay, we'll do some tests and I'll refer you to see a cardiologist. So it took a year for me to see a cardiologist at the hospital, but in the meantime I did have a heart rate monitor, 24-hour heart rate monitor, had like a heart scan and some other things like this, like ECG and all of this. So I had a heart rate monitor, and what it showed is my heart rate throughout the day changed between 80 beats per minute and 160 was the top. It kept changing, and it correlated, like I was pressing the button when I was standing up and having like more, my heart rate was going higher. It correlated with standing up and being upright basically. So that was how my cardiologist was able to understand that, and she did I don't know if it was a stand test, but we did something, and she was able to determine basically from what I told and the symptoms and everything that it was probably POTS. She says there are official ways of diagnosing it, like the tilt table, which I have read about, and it just sounds like torture. Like, why we have to do this? It just sounds like torture when you could just stand up. Like, okay, so I didn't want that anyway, to be honest. And in the meantime, like, my GP gave me beta blockers, like a bisoprolol, I think it's called, 5 milligrams, and they are helping. They helped me, like, initially, like, straight away. My heart rate, like, was still going up, like, quite a bit when I was standing up, but it had kind of taken it from here, like, where it's a higher end, to here, so it kind of lowered it down, even though it's still going up the same amount of beats extra. And so I've been, like, I struggle so much in the summer. Heat is just terrible for it, like, so bad. I have to sleep downstairs. I've got an air conditioner, like, it's so bad. So my cardiologist has recommended some lifestyle changes to me, such as drinking more, and I've started doing that already, and that seems to be a big help. And And I knew about the drinking thing already, but she told me 6 litres a day, so I'm trying to drink 6 litres. She told me 3 litres a day, so I'm trying to drink 3 litres a day, and it is helping me. And yeah, the tablets are helping me, especially with the headaches and the migraines. They have decreased quite a lot, which is fantastic, because that was just hell. And then exercise, so I'm gonna go and exercise in a little bit. So I've been trying to do a little bit of exercise to build myself up to it, but every time I do it, even if it's just like 15 minutes, I feel terrible. And the next day I have brain fog, I have like visual problems, like everything's blurry, I have to keep trying to focus my eyes all the time, and this is just sitting up. And I have to build up my tolerance, so it's going to be really difficult to do that, and it's so frustrating. Like sometimes I just get like upset, because I'm just like, I have to really put in all this effort and feel terrible and spend all these hours trying to recover from this, just to build up my fitness levels, which is going to help me. So at the moment I'm just doing Pilates, lying down on the floor, and I'm still suffering like this, and I'm laughing about it, but it is horrible. But I've been putting off exercise for so long because I was scared to do it, because it just makes me feel terrible, and now I'm just like, I'm just gonna have to suck it up and do it. But I'm trying to do it in small increments, so hopefully that will make it a little bit easier on my system. And I think the other little thing that I wanted to mention was that I am going to talk to my doctor, my psychiatrist, about my ADHD medication, because there is some evidence that I have read. There's some studies that suggest that atomoxetine is actually worse for ADHD. No, not for ADHD, obviously it's good for ADHD. Generally it's good for ADHD. There's some mixed reviews out there, you know. But atomoxetine can be bad for POTS. It can make your symptoms worse, and it can increase your heart rate on standing, and I definitely saw an increase in my heart rate, and I was telling my doctor this, and this was one of the reasons I wanted to take a dose down like a couple of years ago, whenever it was, and there was an increase in my heart rate, and I made a video like the symptoms I don't talk about, like the side effects, and that was a side effect for me. And no wonder, like it's probably not a side effect in a lot of people, it's probably just a side effect in me because I have POTS. And another interesting fact about POTS and ADHD is that there is some kind of link there. So something, and the atomoxetine has like this chemical in it called norepinephrine. I never know how to say that right. And POTS also has something to do with norepinephrine. So there's some kind of link there. I'm not entirely sure what it is. I might try and do a bit more research into that. There probably isn't that much to read up about, but really interestingly, 1 in 10 women who have POTS have ADHD. So that is really, really interesting. I mean, I definitely have ADHD. It's definitely not fully POTS that's the symptoms that I'm having. I know I definitely have ADHD, like throughout my life I can see that 100%, but they are somehow comorbid. And I know a lot of neurodivergent people also have EDS, which is Ehlers-Danlos syndrome, or how do you say that, hypermobility basically. And like, I don't have any hypermobility. Like, my skin is like the opposite of stretchy, and my joints I don't have problems with joints. I don't really have that many other issues that cannot be explained through POTS. And like, it can be secondary to EDS basically, but I don't think I have it. And so that's interesting to think, where did this come from? It definitely came from when I was a teenager, but where, I'm not sure. Is it primary, is it secondary? I don't know. But yeah, I just wanted to kind of make the link there with ADHD because I thought that was really interesting. So I'm going to speak to my psychiatrist next week, so I might make another video based on how that went. And yeah, so yeah, it was just, I don't know if I'll be changing medication. Basically, I'm just going to ask his advice if he's heard anything about this, if he could look into it, because he is obviously going to be somebody who can understand research papers a lot more than I can on this particular topic. So I think it'd be really interesting to see what he thinks, and to see if he thinks that I should change medication or not. Like, my medication works so well on me mentally, but the downside is it might make my POTS symptoms worse. So I can't say that I noticed that my POTS symptoms really got worse. I think on some level, like, they did. Like I say, my heart rate increased, and I guess I don't feel as energetic as I did. Like, I definitely started to feel more tired, like a bit of fatigue and stuff when I started taking the medication, but who knows what the cause of that was. It's so hard to know. So yeah, I will have a discussion with my psychiatrist, and hopefully that will clear some things up around that. So yeah, is there anything else that I'm just gonna, maybe I'll just read through the symptoms of POTS just to like finish out. And I'd also recommend, if you do have POTS and you live in the UK, there's information for employers about POTS. Sorry, it's backwards. And this is really good to give to your employer. So that's what I've done. And I also gave my employer this. And both of them are recommended through the NHS website under POTS. So, they're good sources. So symptoms are fainting, dizziness or lightheadedness, fatigue, insomnia, palpitations, blurred vision, weakness, venous pooling or discoloration of the ankles or feet. So that's when you're like your feet, and sometimes even like your hands can go like purpley colours because of blood pooling. And I've seen this more in my hands. I always wear socks, so I don't know about my feet. But chest pain, so I don't get chest pain, but I get everything else except the fainting. I get pre-syncope, which is like you feel like you're gonna pass out, but you don't quite. And then possibly related symptoms, which I also have, so loss of concentration, migrainous headache, fatigue, although fatigue was in the first part, so that's really odd. Shortness of breath, coldness of legs and fingers, body temperature regulation issues, so that's a major one that I suffer with. Like, if I get hot, my body doesn't cool down, and it can be really, really uncomfortable. Hyperventilation, very fast breathing. So yeah, I have like the majority of the symptoms as well, but they're just such things that they could be something else, and like I've read like on other sites as well, like bladder problems as well can be a big deal, and I definitely had those. There's just so many different symptoms that it's such a hard thing to diagnose. And I think knowing that you have heart palpitations and checking out like your graphs, if you've got like a sports watch, like just checking them out is probably the main way that you can start to look into it. And I think that's maybe the way people figure it out. I don't know, that's the way I kind of figured it out. So there's things you can do. Like I say, it's not a life sentence, but it can be really, really hard to live with. I'm just very thankful that I have answers, basically, and I can take steps to help myself. But then again, I know in certain situations it's going to be really difficult, and I don't know, like the summers are just the worst and I cannot cope. But we're in the autumn now, so I'm happy enough. So yeah, if you've watched this whole video, thank you, and I guess I will see you again in a future video.